when you go down the sex therapist, coaching, sexology, relationship, there's a lot of stuff.
Yeah,
And
it's layered.
I want to make sure that I'm honoring what you do, the
Okay.
framework with which you do it in.
Okay.
So what do you do?
So, so I once was a relationship coach,
Okay.
right? And I was thinking about this earlier, the difference between being a coach and being a therapist. So the way I kind of have it in my brain, as a coach, I might talk to someone about issues they're having with dating, and if they're on dating apps, I might say, well, let's look at your profile. Let's make some changes to the profile. As a therapist, I'm going to dig deeper than that and say, well, where do you think the issues stem? What has happened in your life prior to now that makes you feel like there's some fear or unworthiness or anxiety wrapped around how you date? And then we're going to talk about that stuff, as opposed to just dating as a practice. Does that make sense?
Yeah.
Yeah.
Because it's different. Are you trying to achieve something, or are you trying to fix something?
Yeah.
And sometimes they can be similar.
Very similar. And I remember when I first really dug a little deeper into the therapist role, it occurred to me that as a coach, I help you discover things. But as your therapist, I help you recover from things. And I like the recovery process better, because you're going to operate differently if you have recovered from things, as opposed to just discovering that it's there. You can discover all day that, I dealt with this and this affected me. But how do you recover from that?
Yeah.
So
Now, is it the recovery piece that you like more because that's a little bit more reflective of where you are in your journey and what you feel you've benefited from the most when you look in?
So I think it depends on the issue. Like some issues I've never dealt with, I may have studied about them, but I might not have ever experienced them personally.
Okay.
There is still some piece of enjoyment in the recovery of that, because for me, the recovery process is all about helping the client change, helping them, identify the issues. And maybe it's not always what we call the presenting issue, what you're coming to me for.
Mm-hmm.
But being able to, yes, deal with that, but then also recover from all the other things that you believe have caused that in the first place. And seeing change in real time for that person.
My initial thought about coaching versus therapist was that the therapist had a higher level or a higher grade. But what I was learning, what I discovered is that they're very different things, and I think coaches get to paint with a broader brush, get to implement different types of things, where therapists are like more rigid in their approach.
I would say I agree with that to some level. I think there are definitely boxes for both, right? With a coach, there's a broader way that you can approach things, but again, you're helping people discover ultimately. You're not necessarily diagnosing an issue and then helping that person using interventions that help them ultimately recover from that issue.
Okay.
And so for me, and then there's a different level of training. Like I have to be degreed to be a therapist.
Yeah.
And I have to have some specific training. I have to have some specific opportunity to actually work with clients. And then also, if I have to be tested to be licensed if I want to do it as well. So, and then there's also a code of ethics that I have to operate under. So for me in particular, as a marriage and family therapist, although I focus on sex therapy, there is something called the American Association for Marriage and Family Therapy. And there's a code of ethics within that. And that code of ethics lets me know what kind of core values I need to be focused on, ethics and laws within where I live that I have to follow, or else I don't get to practice.
Got you.
So, and I can, and I don't necessarily have to follow those as a coach. I could probably do a lot of unconventional things as a coach.
Right.
But as a therapist, yeah, you got some rules.
You got some. You got a box.
You got a little bit more of a box.
Okay. So, and do the aspects of your ability extend to like physiology type stuff, like premature ejaculation?
Absolutely.
Okay.
Absolutely. So there's like 4 things within sex therapy that most sex therapists deal with. And it's desire, arousal, orgasm, pain. And so within that like arousal, desire kind of area, you got premature ejaculation, delayed ejaculation, erectile dysfunction. These are for men specifically. And then something called Peyronie's disease, where now I chuckle because Peyronie's disease actually is serious.
Okay.
And it's very painful for men, but I'm gonna give you some layman's terms on it. It's
Okay.
really a curved dick.
Oh.
And so there are a lot of women sometimes that really enjoy that. But if it's actual Peyronie's disease, then sometimes the penis can be almost at a 90-degree angle, and that's very painful. Your face is, it can be extremely painful for men. And there are instruments that can be used. There's, sometimes you even have surgery that happens for, yeah. So there's some women that are like, oh, I like it curved. But for men, if it's curved to a certain extent, no, that's painful. You're sitting there like, wow.
I didn't even know that was
It's a thing. It's a thing.
Because to be honest, I don't spend a lot of time talking to my homeboys about curved dicks.
Most don't. Most men don't.
And so that's why I didn't even know that was a thing. So
but it's a thing, yeah.
Okay. And shout out to the brothers who suffer from that, man. God bless you.
I know.
Listen.